Welcome to NSG 229, Study Session 19, Integrated Management of Childhood Illness, IMCI. Introduction. Integrated Management of Childhood Illness, IMCI, is a strategy that has been developed by World Health Organization, WHO's Division of Child Health and Development, and UNICEF to ensure that every ill child gets first-level health facilities in low-income countries with diagnostic support such as radiology and laboratory services, drugs, and equipment availability. It is an integrated approach to child health that focuses on the well-being of the whole child rather than on a single disease or condition. It also looks into adjustment of the corrective interventions to the capacity and functions of the health system, and active involvement of family members and the community in the healthcare process. In this lecture, you will learn about the Integrated Management of Childhood Illness, IMCI. Learning outcomes. At the end of the study, you should be able to 1. Describe IMCI. 2. State why IMCI is necessary in Nigeria today. 3. Explain the general assessment of a sick child. Integrated Management of Childhood Illness, IMCI. IMCI is an integrated approach to child health that focuses on the well-being of the whole child. IMCI aims to reduce death, illness, and disability, and to promote improved growth and development among children under 5 years of age. IMCI includes both preventive and curative elements that are implemented by families and communities as well as by health facilities. The strategy includes 3 main components: improving case management skills of healthcare staff, improving overall health systems, improving family and community health practices. In health facilities, the IMCI strategy promotes the accurate identification of childhood illnesses in outpatient settings, ensures appropriate combined treatment of all major illnesses, strengthens the counseling of caretakers, and speeds up the referral of severely ill children. In the home setting, it promotes appropriate care-seeking behaviors, improved nutrition and preventative care, and the correct implementation of prescribed care. The IMCI is a strategy for reducing mortality and morbidity associated with major causes of childhood illnesses. It is a joint WHO and UNICEF initiative since 1992 and currently focused on first-level health facilities. It comes as generic guidelines for management which have been adapted to each country. Diseases such as pneumonia, diarrhea, dengue, hemorrhagic fever, malaria, measles, and malnutrition cause more than 70% of the deaths in children fewer than 5 years of age. All these are preventable diseases in which, when managed and treated early, could have prevented these deaths. There are feasible and effective ways that health centers can care for children with these illnesses and prevent most deaths. WHO and UNICEF used updated technical findings to describe management of these illnesses in a set of integrated guidelines for each illness. They then developed this protocol to teach the integrated care management process to health workers who see sick children and know which problems are most important to treat. Therefore, effective case management needs to consider all of a child's symptoms. For those children who can be treated at home, caregivers are taught how to provide treatment and when to seek care for their children. The guidelines also identify actions to prevent illness through the immunization of sick children, supplementation of micronutrients, promotion of breastfeeding, and counseling of mothers to solve feeding problems. It is also an important factor to teach families when to seek care for a sick child as part of the care management process. This approach, which combines steps to manage and prevent several different conditions, is comprehensive and systematic. Integrated management of childhood illness (IMCI) is a strategy that has been developed by World Health Organization (WHO's) Division of Child Health and Development and UNICEF. It is an integrated approach to child health that focuses on the well-being of the whole child rather than on a single disease or condition. Children brought for medical treatment in the developing world are often suffering from more than one condition, making a single diagnosis impossible. IMCI is an integrated strategy which takes into account the variety of factors that put children at serious risk. It ensures the combined treatment of the major childhood illnesses, emphasizing prevention of disease through immunization and improved nutrition. IMCI includes both preventive and curative elements that are implemented by families and communities as well as by health facilities. It aims to reduce death, illness, and disability, and to promote improved growth and development among children less than 5 years of age. This strategy was developed in order to address the serious challenges affecting the provision of quality care to sick children. Some of the factors that cause the challenges are inadequate living conditions, such as poor water supply and sanitation, which promotes rapid spread of diseases. Limited supplies and equipment leave doctors with few opportunities to practice complicated clinical procedures. Instead, they make the best use of the available resources. Inability of parents to recognize the degree of their child's illness. Parents may not recognize that their children are dangerously ill and not take them for appropriate treatment, etc. 1 million children under 5 years old die each year in less developed countries. Just 5 diseases: pneumonia, diarrhea, malaria, measles, and dengue hemorrhagic fever account for nearly half of these deaths, and malnutrition is often the underlying condition. Effective and affordable interventions to address these common conditions exist, but they do not yet reach the populations most in need, the young and impoverished. Meaning of illness and hospitalization to a child. Infant, child in familiar routine and surroundings response with global reaction. Separation from loved objects. Toddler, A. Fear of separation, desertion, separation anxiety, highest in this age group. B. Relate illness to a concrete condition, circumstances or behavior. Preschool, fear of bodily harm or mutilation, castration, intrusive procedures. Separation anxiety, less intense than toddlers, but strong. Causation same as toddler, often considers own role in causation, that is, illness as a punishment for wrongdoing. School age, fears physical nature of illness, concern regarding separation from age mates and ability to maintain position in peer group. Perceives an external cause for illness, although located in body. Adolescent, anxious regarding loss of independence, control, identity, and concern about privacy. Perceives malfunctioning organ or process as cause of illness. Able to explain illness. Preparing the ill child and family for hospitalization. Many childhood illnesses such as febrile convulsions, appendicitis, and asthma attacks strike suddenly, making advanced preparation for hospital admission impossible. However, when hospitalization is planned ahead of time, e.g., for orthopedic second stage surgeries, preparation is possible. As a rule, parents eagerly seek guidance from nurses on what and how much to tell their children about an anticipated admission. The preparation a parent makes for a child obviously varies according to the child's age and individual experience. No matter what the child's age, however, parents should be encouraged to, above all, convey a positive attitude. The nurse can provide further health teachings and clear up all misunderstandings. Preparing the infant. Because the infant cannot understand explanations, preparation has to be minimal. Special items such as favorite toy, blankets should be packed. Caregivers should spend a great deal of time with an infant, preparing the toddler and preschooled. 1. Three chief fears of the toddler and preschoolers are fear of unknown, fear of abandonment and separation, and fear of mutilation. 2. These children need preparation clearly aimed at alleviating these fears. 3. Bringing a favorite toy can be a help. 4. Child could be encouraged to play with dolls. 5. Condition. Preparing school age and adolescents. Both school age and adolescents need factual explanations of what will happen during hospitalization. A hospital orientation program in which facts of hospitalization are discussed should be used. Introduce the child to another child who had undergone the same condition. Preparing the child of a different cultural background. A. Give assurance that proper care will be provided to the child without any differentiation. Preparing disabled and chronically ill child. 1. Help children to maintain a contact with their families and school friends during a long hospitalization period, as they are staying in hospitals for long term. Provide opportunities for care through phone calls, letters, and open visiting. Preparing the family or caregiver. A. Planning for hospitalization begins as soon as parents know that hospitalization will be necessary. B. Easing parental anxiety regarding illness and hospitalization is important because infants and children can keenly sense a parent's stress. C. As a part of preparation, parents should ask questions about the hospitalization so that they become familiar with the situations. It will help to reduce anxiety. D. Advise parents to ask about the diagnostic procedures, required length of hospital stay, etc. Common reaction of different age groups to hospitalization. The following are the common reaction of different age groups to hospitalization. Regression. Children and teens can sometimes regress as a way of coping with a new situation. For example, a child who has recently been potty trained may wet the bed for a period of time. Other children may adopt an old comforting style that they had given up, like sucking a thumb, becoming more clingy to parents, or whining more than before they came to the hospital. Aggression. Many decisions are made for children and teens in the hospital, and they often feel a sense of having no control. It is common for children and teens to react to this with anger. These responses sometimes include crying, yelling, kicking, or resisting medication. Withdrawal. Some children and teens respond less openly to hospitalization or treatment by withdrawing. For example, parents may observe their child or teen becoming less interested in activities they used to enjoy, sleeping more, talking less, eating less, or not making eye contact. Why is IMCI necessary? According to the 1999 World Health Report, children in low to middle income countries are 10 times more likely to die before reaching age 5 than children living in the industrialized world. In 1998, more than 50 countries still had childhood mortality rates of over 100 per 1,000 live births. Every year, more than 10 million children in these countries die before they reach their 5th birthday. 7 in 10 of these deaths are due to acute respiratory infections, mostly pneumonia, diarrhea, measles, malaria, or malnutrition, and often to a combination of these conditions. Every year, almost 11 million children under the age of 5 in developing countries die from readily preventable and treatment illnesses such as diarrhea, dehydration, acute respiratory infection, ARI, measles, and malaria. In half of the cases, illness is complicated by malnutrition. While improved medical treatment combined with greater access to healthcare has helped children in many parts of the world, in others, huge numbers of children continue to die needlessly. Many of these children were never seen at a health facility because services do not exist. Their families lack access to these services, or families and other caregivers do not recognize the warning signs of life-threatening illness. Quality of care is another important indicator of inequality in child health. Every day, millions of parents seek health care for their sick children, taking them to hospitals, health centers, pharmacists, doctors, and traditional healers. Surveys reveal that many sick children are not properly assessed and treated by these health providers, and that their parents are poorly advised. Providing quality care to sick children in these conditions is a serious challenge. Yet, how can this situation be reversed? Evidence-based medicine stresses the importance of evaluation of evidence from clinical research and cautions against the use of intuition, unsystematic clinical experience, and untested pathophysiology for medical decision-making. An evidence-based syndrome approach can be used to determine the health problems the child may have, severity of the child's condition, actions that can be taken to care for the child, e.g., refer the child immediately, manage with available resources, or manage at home. Objectives of IMCI: 1. To reduce significantly global morbidity and mortality associated with the major causes of illnesses in children. 2. To contribute to healthy growth and development of children. Components of IMCI. The strategy involves 3 components which are listed below. Improving case management skills of healthcare staff. IMCI ensures that healthcare practitioners are taught to rationalize treatment, prescribing the minimum number of essential medicines. IMCI strategy also promotes the accurate identification of childhood illnesses in outpatient settings. IMCI ensures appropriate combined treatment of all major illnesses, e.g., pneumonia, diarrhea, malnutrition, fever, HIV, AIDS, etc. IMCI also strengthens the counseling of caretakers systems, improving overall health. IMCI aims to improve the whole health systems which deliver care to individuals by 1. Improving follow-up visits to patients that had been discharged. 2. Ensuring that essential drugs are available in the healthcare facilities. 3. Increasing the quality of supervision and support of practitioners. 4. Taking efficient stock control of medicines. 5. Ensuring efficient transport systems for quick referral to hospitals. Also, IMCI sets out to improve overall health systems by encouraging clinical science-based intervention. Severely ill patients would require urgent hospital referral. Moderately ill patients would require specific treatment at primary health care facilities and at home. Mildly ill patients would require supportive therapy and counseling at home. Improving family and community health practices. A. Health practices directly influence the overall health conditions of individuals. Hence, if the family and community health practices can be improved, the health of the people would be promoted. Some of the health practices that should be improved on are: B. Unhygienic conditions. It involves poor water supply and poor sanitation, which promotes the rapid spread of disease. C. Incorrect implementation of prescribed drugs. If drug regimen is not followed correctly, the illness would persist and aggravate. But if the drug regimen is correctly implemented by parents or guardians, the illness would be abated. Inadequate nutrition. Nutrition is very essential in children as it encourages their growth. A child's rapid growth is determined by adequate nutrition, since deficiency of nutrients impede growth. Principles of integrated care. The IMCI guidelines are based on the following principles. 1. All sick children must be examined for general danger signs, which indicates the need for immediate referral or admission to a hospital. 2. All sick children must be routinely assessed for major symptoms. For children aged 2 months up to 5 years, cough or difficult breathing, diarrhea, fever, ear problems. For young infants, aged 1 week up to 2 months, bacterial infection and diarrhea. They must also be routinely assessed for nutritional and immunization status, feeding problems, and other potential problems. 3. Only a limited number of carefully selected clinical signs are used, based on evidence of their sensitivity and specificity to detect disease. These signs were selected considering the conditions and realities of first-level health facilities. A combination of individual signs leads to child classifications rather than a diagnosis. Classifications indicate the severity of conditions. They call for specific actions based on whether the child should be urgently referred to another level of care, require specific treatment such as antibiotics or anti-malaria treatment, or may be safely managed at home. The classifications are color-coded. Pink suggests hospital referral or admission, yellow indicates initiation of treatment, and green calls for home treatment. 5. The IMCI guidelines address most, but not all, of the major reasons a sick child is brought to a clinic. A child returning with chronic problems or less common illnesses may require special care. The guidelines do not describe the management of trauma or other acute emergencies due to accidents or injuries. 6. IMCI management procedures use limited number of essential drugs and encourage active participation of caretakers in the treatment of children. 7. An essential component of the IMCI guidelines is the counseling of caretakers about home management, including counseling of caretakers about feeding, fluids, and when to return to a health facility. Strategy for the integrated approach. Depending on a child's age, various clinical signs and symptoms have different degrees of reliability and diagnostic value and importance. The IMCI guidelines recommend case management procedures based on 2 age categories. 1. Children aged 2 months up to 5 years. 2. Young infants aged 1 week up to 2 months. The case management process. The case management process is used to assess and classify 2 age groups. A. Age 1 week up to 2 months. B. Age 2 months up to 5 years. And how to use the process shown on the chart will help us to identify signs of serious disease such as pneumonia, diarrhea, malaria, measles, DHF, meningitis, malnutrition, and anemia. The case management process. The chart prescribes the following steps. Assess the child or young infant. At the outpatient health facility, the health worker should routinely do basic demographic data collection, vital signs taken, and asking the mother about the child's problems. Determine whether this is an initial or a follow-up visit. The health worker then proceeds with the IMCI process by checking for general danger signs, assessing the main symptoms and other processes indicated in the charts below. Take note that for the pink box, referral facilities include district, provincial, and tertiary hospitals. Once admitted, the hospital protocol is used in the management of the sick child. 2. Adapting the standard IMC clinical guidelines to the country's need, available drugs, policies to the local goals, and language used by the population. 3. Upgrading care in local clinics by training health workers in new methods to examine and treat children and to effectively counsel parents. 4. Making upgraded care possible by ensuring that enough of the right low-cost medicines and simple equipment are available. 5. Strengthening care in hospitals for these children too sick to be treated in an outpatient clinic. 6. Developing support mechanisms within communities for preventing disease, for helping families to care for sick children, and for getting children to clinics or hospitals when needed. IMC has already been introduced in more than 75 countries around the world. Prevention and treatment strategies. Prevention and treatment strategies have proven effective for saving young lives. A. Childhood vaccinations have successfully reduced deaths due to measles. B. Oral rehydration therapy has contributed to a major reduction in diarrhea deaths. C. Effective antibiotics have saved millions of children with pneumonia. D. Prompt treatment of malaria has allowed more children to recover and lead healthy lives. E. Even modest improvements in breastfeeding practices have reduced childhood deaths. F. Many of these interventions have been summed up into 16 key family practices. While each of these interventions has shown great success, accumulating evidence suggests that a more integrated approach to managing sick children is needed to achieve better outcomes. Child health programs need to move beyond single diseases to addressing the overall health and well-being of the child. Evaluation of IMC. The impact of the strategy is being evaluated by impact, cost, and effectiveness. The results of IMC support the planning and advocacy for child health interventions by ministries of health and developing countries and by national and international partners in development. To date, IMC has been conducted in Brazil, Bangladesh, Peru, Uganda, and the United Republic of Tanzania. The results of the IMC indicates that 1. IMC improves health worker performance and the quality of care. 2. IMC can reduce under 5 mortality and improve nutritional status if implemented well. 3. IMC is worth the investment as it costs up to 6 times less per child correctly managed than correct care. 4. Child survival programs require more attention to activities that improve family and community behaviors. 5. The implementation of child survival interventions needs to be complemented by activities that strengthen system support. 6. A significant reduction in under 5 mortality will not be attained unless large-scale intervention coverage is achieved. Summary: the World Health Organization (WHO) and UNICEF developed integrated management of childhood illness (IMC) as an approved delivery strategy for child survival interventions to help reduce morbidity and mortality in children. IMC aims to reduce morbidity and mortality due to the major killer diseases for children under 5: malaria, diarrhea, malnutrition, measles, acute respiratory infection, and HIV/AIDS. The IMC strategy looks at the child holistically, as children often have more than one condition. We also furthered our study discussing the various components as required in this material. End of study session 19 and end of NSG 229. Thanks for listening.